Hello, folks. It's Dr. Graham here at the Daily Dentist. Today, we're going to be talking about tooth whitening or teeth whitening. A lot of times, people always ask me about whitening their teeth, and it's a few things I want to talk to you about the importance before you getting your teeth whitened. A lot of times, when you're going to have someone's teeth whitened, you want to make sure they have good, healthy gums, no gum disease, no problems, no toothache or large cavities or anything like that. Because you don't want to put anything on the tooth that's going to aggravate those areas. If you have gum disease, whitening teeth with gum disease, it's going to cause more problems with your gum and the supporting structure underneath. And so anytime you're considering whitening your teeth, you want to at least have your teeth checked out by your general dentist and make sure they're clean and that your mouth is healthy and problem free. The next thing with whitening teeth, if you have tooth colored fillings, those will not lighten. They will not change colors. So if you have any tooth colored fillings in your front teeth or any teeth that you're trying to whiten, what you want to do is if you whiten the teeth, you're more likely you're going to have those fillings, tooth colored fillings replaced after you've lightened your teeth. The reason you don't want to change them beforehand is because as the teeth lighten, we need to be able to match the color, your final color of the teeth will be. So you don't want to try and change the teeth beforehand and then lighten the teeth, assuming you can get to the correct color. You lighten the teeth after the teeth have been cleaned properly. You lighten the teeth, and then you have to go back and have those tooth colored fillings changed out. So those things that can be add a little more cost to just whitening teeth. But I want to talk to you about those things so you kind of have an idea of what to expect before whitening teeth. A lot of days now you have things that come through the mail and you can get online about whitening teeth. And I discourage you from doing those things, especially if you haven't seen a dentist in the past year or 6 months prior to whitening your teeth, because you want to, again, like I said, make sure your gums are healthy, make sure you don't have any large cavities or areas of decay that can become more problematic from the whitening gel. And those are some tips about whitening the teeth. Now, when we whiten teeth, what that involves, you have two different types of procedures where you can whiten the teeth. You can do one procedure where you come to the office and they can do the in-office whitening. And that's a little more costly because you're doing it right then, right there, and you get the result right away. Or you can do the take-home trays where we come in, we take some impressions or molds of your mouth, basically making a copy of your mouth, and we make some trays from your mouth there, okay? You're gonna get the same result either way you get it done, whether it's in office or you take home. It's just gonna take a little more time if you take home. Usually within about 2 or 3 days of doing it, you will see the difference on the take home trays. A lot of times people with the take home trays, they may try and wear them for an hour, 2 hours. No, you wear them for maybe about anywhere from 45 minutes to an hour at the most. And then after that, the whitening gel starts to break down. So it's not lightening the teeth anymore. It's just going to be causing more problems with the whitening gel getting on your gums and just irritating the mouth. So anywhere from 45 minutes, no more than an hour for the whitening trays. And you just do it, once a day. After you receive the color that you're happy with, then you may have to go back and just lighten or touch them up maybe once a month there. Especially if you're a person that drinks a lot of red wines or teas or something like that, then that may tend to stain the teeth more. But that's what you want to do as far as trying to maintain it and how long you want to wear it. You don't want to wear it for very long periods of time. Like some people say, oh, can I sleep with them? No, you don't want to sleep with them. Like I said, you just wear them for about 45 minutes to an hour. After that, you take them out of your mouth. You want to go back and brush your teeth with a nice fluoride toothpaste because that's going to take care of any sensitivity. A lot of times before I whiten a person's teeth, after I check their teeth out, I may put them on a fluoride paste for maybe about a week prior to that because that's going to decrease a lot of the sensitivity that you may get from whitening. And sensitivity is normal with whitening teeth. Because teeth are porous, they're not solid structures, some of the whitening gel gets in through the pores of the teeth, and that's when they pull out all the dirty stuff to help lighten the teeth up. And so prior to that, I put the patient on a fluoride paste to brush with for at least a week. You're brushing at least once a day with that to help get the teeth ready for whitening, and it will decrease a lot of the sensitivity. As you're whitening the teeth, Like I said, once you want to get the whitening gel out, you rinse your mouth with warm water, not cold, because the teeth may be a little sensitive. Warm water, and then you go back and brush your teeth with just normal fluoride toothpaste, and then you can use some of the fluoride gel that I provide for my patients to brush with after whitening. And you want to do this every time after you whiten your teeth, and that's going to help decrease the sensitivity. Back to some of the trays. I have a little model here that we take an impression or mold of the mouth, and this is a model of a person's mouth that we had, and we take the mold and then we make trays from it. These trays are like little plastic type trays that you can get to come off. You can take them off, and they basically fit right on your tooth, your own teeth. So you can't interchange these. They're only going to fit the person's mouth they're made to fit. Okay? And so it's just like little plastic trays that you'd fill up with the gel, put them in your mouth, and then, like I said, you keep them in for about 45 minutes, no longer than an hour. And these are going to help, whiten the teeth. And like I said, over time, usually about 2-3 days of lightening, you will see some results with whitening teeth. Another thing about teeth whitening, people ask me about over-the-counter whitening trays. One of the over-the-counter products that I know work is Crest White Strips. They work really well. They're the only ones accepted by the ADA, and that has been proven to lighten your teeth. The thing about those, you have to make sure you fold it on the teeth correctly. They're kind of like, I tell patients, like a little Band-Aid. You're trying to fold across the front of the teeth, front and back of the teeth, get it on there, get the gel, and you keep those positions on the teeth. If you're missing certain teeth or the teeth not correctly straight, you may not be able to lighten the teeth properly because it won't fold or contact the tooth evenly, so it may spot whiten the teeth. But they do work. But if your teeth are nice and straight, you can get a good result from that. If you have some malalignment or teeth not straight correctly, then you'll get certain whitening areas on the teeth and not the whole tooth becoming white. So hopefully this answers a lot of your question about whitening teeth and and the procedures you need to have done before you get a whitening done, just to make sure your mouth is healthy and you get a good result. Thank you again. I'm Dr. Graham at the Daily Dentist, and we'll see you next time. Have a great day.